Welcome to the High Vibe Moms Club, the podcast for ambitious women ready to ditch burnout, diet culture, and mom guilt so they can feel hot, healthy, and radiant from the inside out. I'm your host, Shannon, and this isn't just another wellness podcast. It's a movement. If you're ready to raise your vibe, reset your health, and step into your most confident self, you're in the right place. Welcome back to another episode of High Vibe Moms Club. Today I am joined by Dr. Angela Casey, a double certified dermatologist who focuses on helping women simplify their routines and support our skin in a way that actually fits into real life, especially during our seasons of stress, hormonal shifts, and motherhood. And what I love about Dr. Casey's approach is that she brings a more holistic and realistic perspective to skincare. Instead of adding more pressure or complexity, she helps women understand what truly matters so they can care for themselves in a way that feels supportive and not overwhelming. So, Dr. Casey, I am so excited to have you here. Welcome to the show.
Thank you so much, Shannon. I am thrilled to be here. I appreciate the invitation, and I'm excited to connect with you and your listeners.
Yeah. So I want to start with your background, your story. Can you share a little bit about your journey into skincare and what led you to this focus in health?
Sure. So I am a full-time, as you mentioned, double board certified dermatologist and micrographic dermatologic surgeon. So in my practice, I primarily focus on skin damage and more specifically skin cancers and treat those with a procedure called Mohs micrographic surgery, which is surgical removal of skin cancers. I then look at the skin under the microscope while the patient's in the office, mapping out all the cancer cells and clearing those, and then performing same-day reconstructive surgery for my patients. So always kind of addressing that chronic sun damage, skin damage that occurs throughout our lifetime, and really offering patients a solution where they come in with their skin cancer and they leave without it and everything's fixed up. So that's my current career. I'm also the mom of 3 teen and tween daughters, which is very important, and wife to my amazing husband, Michael. But how did I get here? I grew up in Louisville, Kentucky as the daughter of a physician. My dad is an infertility specialist. And through his work and in seeing him and his impact on other individuals, I realized what a gift it is to be in healthcare and to be able to take care of patients, to use our expertise to offer a solution. So that's what led me into medicine. I went to Vanderbilt University for undergrad and majored in molecular biology and mathematics. So I've always been a little bit of a geek and science nerd. So I love kind of deep diving into the why and the molecular basis for things. And now I do that daily as it relates to skin. I then went on to University of Louisville for medical school and did my residency at the University of Pittsburgh in dermatology, and finally fellowship at the University of Vermont. But what I really love about the skin is that it tells such a story of our lives, and it's there for us through this incredible journey. It's our largest organ and is often the manifestation and really the advertisement, so to speak, of what's going on with us internally. So all the stress, the inflammation, other diseases often show up and manifest on the skin. And it's our job as dermatologists to diagnose and then kind of get to the answer of what's the underlying root cause, which I think will feed well into the interests of your particular community.
Yes. No, I love that. My background is actually in civil engineering. And so I did a lot of science and math. So when you're talking about that, I'm like, oh, okay, we probably have a similar undergrad story.
Right. We were STEM kids, right? Before STEM was so popular.
Yes. That's amazing. And then, oh my gosh, I almost went off on a tangent because my son has allergies and the skin, but I'm gonna stick to our listeners today. So you talked about the skin is kind of like a journey and showing who you are and what you've been through. with that being said, how would you say that a mama, women who are dealing with essentially chronic stress and feeling overwhelmed and juggling all these things, how is that reflected or how is it shown on our skin?
Yeah. So in the acute setting, stress, we will see conditions such as acne, eczema, sensitive skin, seborrheic dermatitis, flare. And many of us can think of times in our lives, maybe it was when we were taking final exams back in college, maybe it's before we're giving a big presentation at work, maybe it's because we're dealing with a health issue ourselves, or a loved one or family member is going through something. So there are these acute periods of stress that we can probably all remember a time when we saw that in our skin. We got that bad acne breakout. Yes, we got that like red, eczema just kind of went out of control. So there's a very strong link between stress and inflammation in our skin, and that roots back to increased cortisol levels that happen with stress, and that causes increased oil production in our skin, and it also weakens our skin barrier. And the skin barrier is a really important concept that I'm going to keep coming back to in this conversation. We really depend on a strong skin barrier to keep everything in check with our skin health and to really keep our skin looking its best and performing its best. So when we have a disruption to that and that skin barrier is weakened or compromised, our skin is much more susceptible to irritation, whether that's just from environmental factors, whether it's something we eat and then it triggers inflammation in our skin. So that's one part of the stress picture, is when we have that like active acute scenario going on. Then on the other side of stress and skin health is that chronic stress that probably all of us have as moms, as women with high-powered careers, as daughters, as wives. And I kind of think of that as like, it's like a death by 1,000 cuts to our skin.
Oh, no.
It's just like a chronic wearing down over time. So we probably don't notice an immediate change in the here and now. But over time, it's weakening our collagen levels. It's putting stress and strain on our elastic fibers. It's causing this low grade, like a slow burn of inflammation in our skin. And again, it's coming just from those day-to-day stresses, which probably most of us are living every day. We don't quite get enough sleep. We're maybe a little bit dehydrated. Our diet isn't 100% optimized. Maybe we do pretty well, but we're still having some sugar and some alcohol, maybe some gluten, and ingesting these foods that can be very inflammatory to our skin. Not that we're seeing like a big flare in the immediate, but it's this chronic, again, slow damage. So it's a good reminder just how important lifestyle optimization, and I know that's very important to your listeners, but how that really does feed into our skin. And it's very much a marathon and not a sprint as it relates to how we're incorporating those habits in our lives and how that manifests in our skin.
Yeah. So, would you say a lot of what is manifesting on our skin is more of what's going on internally? Because I know a lot of people, like if they have eczema, they're like, go to the doctor and they prescribe a cream. But is the cream actually going to help, or is that just masking the symptom because there's something more internal going on with that?
It's very much treating the symptom and not the root cause. And the truth is that most dermatologists, most physicians do not have the time and energy, and they're not really like set up to be able to deep dive into the why and the root cause. Like that's why you might go see a therapist or you might go see a dietitian, because they can really deep dive and kind of dissect out all those different factors and determine what's the culprit here in this individual. Whereas the dermatologist, they see the issue, they see the manifestation, and we're going to prescribe the medication to treat that. But I really struggle with that approach because it is very much putting a Band-Aid on a symptom and not really addressing the root cause. It's a big downfall of modern medicine as we know it, and just the way that the healthcare system is set up as a whole.
Yeah. So would you say in your practice, do you talk about those lifestyle transitions? I'm not sure why my camera zoomed me in.
It's okay. We can see your beautiful, bright skin. For those of you who are listening, I can see Shannon up close and personal. Her camera has automatically zoomed in. And so I can see she doesn't have a pore visible on her face. It's just perfect skin.
Oh, thank you. I'm actually going to start my period any day. So I'm like, oh no. Is it coming out?
It's glowing. It's radiant. So I do love to address that component with my patients. I wish I had more time with every patient so that we could really dive into it. But yes, part of my counseling with them is just how much all of those lifestyle factors play a role. They so often want an easy fix. They want a cream or a procedure that's just going to magically make their skin glow and erase all the damage. But the truth is, again, it is such, you really have to take a holistic approach to this. And you really do have to think about those other factors, the sleep, the diet. Are you exercising? Is your stress managed? And incorporate that, focus on that if you really want to get the best results. Yes, I can do a laser or a chemical peel, or I can inject Botox or fillers, and it'll help, but it's never going to get to quite as good as it could be is compared to when we have all those other factors in place.
Yeah, absolutely. And so you talked about some of those lifestyle, the nutrition, the sleep. There's so much. I feel like every single time I open my Instagram, it's like another ad of try this. Like I've tried, what is it, like the microneedling thing? I've tried so many different serums and solutions, and it's overwhelming. So is there anything specific as far as, I know you said there's different like laser treatments and things like that when you go see a dermatologist, but are there any self-care habits that a mom listening right now can start today? Like, is there like 2-3 things that you're like, you have to do this? This is the core.
Mm-hmm. Yeah, so it's actually much simpler. And I am not a big advocate of the at-home microneedling devices, red light devices, other like gua sha. We just don't have the evidence to support those modalities. And the issue, it's such an interesting phenomenon how all of these at-home treatments have been so hyped up and overblown, and it's purely a function of social media. They make for good content. It's entertaining to watch somebody doing their microneedling. It's maybe kind of gratifying on some level for us to watch that and observe it, but it's really, when you look at the evidence, it's not nearly as powerful compared to some simple daily habits that you can implement. So the number one is going to be very inexpensive. It's a very low-hanging fruit, and that's wearing sunscreen every day. It comes back to that old saying, an ounce of prevention is worth a pound of cure. And that simple act of putting sunscreen on every day is going to prevent so much of the damage. It's going to protect your collagen and elastic fibers. It's going to prevent that inflammation that I was talking about earlier that's so damaging to the skin. It's going to prevent the hyperpigmentation. And that is a simple thing that's accessible to everybody. You want a mineral-based sunscreen. So you're looking for ingredients like zinc oxide and titanium dioxide, and an SPF 30 or higher, ideally. So that's number one. The second most, and probably I would put this ahead of the sunscreen, is optimizing your sleep. So sleep is such a culprit for so many of the issues that we're concerned about. The flares of rosacea, eczema, poor healing of your skin, accelerating aging and getting fine lines and wrinkles, bags underneath your eyes. So that increased stress compromises the skin barrier. Those bags are going to be more apparent. So maybe more challenging to implement because we're all busy and we all have a million things going on. But sleep is very important. And then when you look at the evidence and the clinical studies about, again, all these at-home devices and the red lights and chemical peels and microneedling, and then you look at that versus long-term consistent skincare always wins. And the star of that show, the hero product, is using a retinol or retinoid on your skin every night. And the reason is that retinoids are clinically proven to help build collagen in your skin, so we can actually get some regaining of collagen that's been lost over time, and then more importantly, maintaining the collagen that we have currently. So we really want your listeners to, if you aren't already on a retinoid, and ideally you want to be on a prescription strength retinoid like tretinoin or tazarotene. You cannot be on those if you're pregnant or breastfeeding. BTW.
I'm breastfeeding, so is there an alternative or just wait it out?
Your alternative is something called azelaic acid, which is, Phenacia is the brand name, but that achieves much of the same benefits as the retinols and retinoids, but it's pregnancy category B, breastfeeding category B, so proven safe for pregnant and nursing mamas out there. But truly, those are your pillars: getting enough sleep, wearing your sunscreen every day, and using a retinoid. And all the other things are optional. They don't, in most cases, hurt your skin, but they are certainly not the magical solution that they are purported to be on social media as we know it today.
Well, I'm glad that you shared that, because I was guilty of the ad and I got the microneedling, and it's painful. I think I've used it like twice, and my skin gets all red and irritated and it burns. And my husband's like, "Are you sure what you're doing is safe? It looks really painful." I'm like, "It feels painful."
And then you have to question, is that really good for your skin? So yes, we have evidence that creating this, what we call a controlled injury to the skin, whether it's through microneedling or with certain laser devices, is beneficial in building collagen and elastic fibers and strengthening the skin. My argument is it's very hard to replicate that in the home setting. It's very inconsistent in terms of how that's approached. And it raises potential for a lot of issues with infection, irritation, scarring of the skin. I have seen some terrible cases in my practice, individuals who had at-home devices and didn't really have the knowledge and expertise to be using them. And it landed them in a tough position, whether that was with hyperpigmentation or scarring or infections.
No.
I prefer, and it is my bias as a dermatologist, but it's also my job to educate and inform your community. Please see an expert for those procedures, whether it's your esthetician, whether it's a nurse practitioner or a physician assistant at a Medi Spa, or it's your dermatologist. Please see them. The procedures that we have in office are so much more powerful in terms of the results and so much more significant, and it's done in a setting that's much safer for our patients.
Absolutely. And then you mentioned that, I forget the exact words you used, but something about like long-term beats trying to do like that quick fix every single time. And I didn't get into a skincare routine until I was about 30. And my mom was always good. She was always putting on lotion and the creams and stuff. So growing up, I was like, yeah, maybe I should do that. And it wasn't until my second baby that I was like, oh, what's happening to my skin, that I finally started a skincare routine. So I've been doing it only for 6 years. But I see like my nieces, they're 8 and they're already starting a skincare routine. So how important, what can we share? Like my little one's 2. So I'm like, I think that's a little too young to start a skincare routine. But when do we actually start to teach our daughters, like, hey, this is what you should be doing daily?
Well, I would argue that we start skincare routines for our children from the moment that they're born. in a way, not that we're teaching them or that we're empowering them. They're too young to understand, but we are, as parents, very conscientious about the products that we bring home for our infants who have this very delicate, vulnerable skin. But from the time that they're born, we're bathing them, we're moisturizing them, we're using sunscreen or some sort of sun protection on them. So really, skincare starts from the moment that they enter the world. It's really when they get to age, as you were mentioning, your niece, like age 8 or 9 is when they're starting to develop a little bit of agency and opinions on their own skincare. They're less likely to let us as parents put the sunscreen on them. They're like, no, I've got it. Let me do it by myself. Like, they don't want us doing that for them. They want a little bit more space and independence. So at that point, it's really up to us as parents to guide them on the right path and put up those guardrails so that they don't deviate into the wrong products or choosing a brand just because the packaging is cute and sparkly or because it smells good. We really... And so some of those brands can be really harmful for young skin. And you have to remember, for our teens and tweens and our children for that matter, their skin barrier is still very much developing. So their skin barrier is not as strong as ours is as adults. And their skin microbiome is still undergoing a lot of fluctuations because of all the hormone changes that are happening. So looking for brands that are really tailored for young skin, that was one of my big whys in creating Bright Girl Skincare, which I created really with my own daughters at the root of the inspiration for that, because I saw them gravitating to brands that were not good for their skin, but yet there weren't a lot of brands that I would recommend as a dermatologist that really connected and were fun for our girls. So with Bright Girl, we kind of hit the sweet spot with clean, pH balanced, clinically proven formulations, and we've tested it all the way into the teen and tween population, but ingredients that are really good for their skin. It's confusing as parents because there are so many options out there. I wanted to give them a solution of a brand that I created for my own daughters and that they would know is safe. And other brands like Cetaphil and CeraVe, generally very gentle formulations, widely recommended by dermatologists. So you're going to be safe with those. So for our young people, when they come to us asking about wanting a skincare regimen of their own, we've just got to guide them and be open to their thoughts on why they like a particular brand. And if we vet it and we decide that's probably not the best thing for them, kind of steer them in the opposite direction. Well, this is why X brand is not good for you. Let's look at this one as an alternative. Or let's go to Sephora together and let's go test some brands and try them out. And I think that kind of gets to that conversation of really using skincare as a bonding tool between parents and children, and not a dictatorship of a parent telling their child, this is what you have to do, and this is your only option.
I have that approach with food. So then that way it feels like it's their decision, and we don't, what's one thing is, it's tough because I don't like to label like food as good or bad because, you know, they all have its purpose, but obviously same with skincare, there are the healthier options. And even with my kids, I've always just done like the mineral ones. And with like my mother-in-law or my parents, when they choose this brand that's like the spray on whatever sunscreen, I'm like, no. Look and see how this one only has like 5 ingredients and that you can't even pronounce any of it.
Exactly. So it's just, kind of redirecting, which is what we do for decades as parents, just redirecting, put them back on the right path. And you're right. When we see long ingredient lists that we can't decipher what those ingredients mean, that can be a bit of a red flag. So understanding and having a basic knowledge of skincare ingredients is so helpful. And when you have questions, that's what dermatologists and estheticians are there for, because we do understand and really deep dive into those ingredients and how they perform on the skin. So can help our patients and clients choose the optimal ingredients for their skin at whatever stage of life they are.
Yes, no, that's so important. and also to model those behaviors too, because it's like one of those things where kids, you could say one thing, but if you're not doing it, it's better to lead through action versus being like, you should do this. And I love that. It sounds like that's your same approach of like modeling skincare and those self-care habits without creating like that pressure of like, this is what you have to do. Um, do you have anything else that you can share with our moms? We talked a little bit about the skincare, and I'll link all that information, and we'll get a little bit deeper in the end of how everyone can connect with you. But just going back to the moms for a final question, when a mama is in a transition, whether that's pregnancy, I know I got, what was it? Is it called melasma, where my skin gets
Melasma. Mm-hmm.
Yeah, so I know like during pregnancy that happened a lot, and there's the postpartum and the chronic stress and all these different stages of life. Besides the sunscreen and the retinol and the sleep, is there anything else that we want to touch on that's so important for moms that keeps our routine simple?
Yeah. So when you think about moms that might be going through a major change like that, and when we think about our lives as women, there are essentially three time periods when we're going through a huge hormonal shift. The first is during puberty, when our hormones are ramping up. The second is during pregnancy. So during pregnancy itself, and then of course in the postpartum when everything shifts again, and then in the perimenopause and menopausal years. So these three periods where things are kind of totally awry with our hormones. And it's very individual in terms of how that affects us. Some of us sail through pregnancy and we glow and our skin looks great and we kind of go into the postpartum and everything's fine. And same with menopause. Some women go through it and really don't have any symptoms. So it's important to take that individual approach and also give yourself grace if you are somebody who's struggling a little bit more and maybe your friend or your sister did not. Just keeping in mind it's very individual. But some of the specific changes we see postpartum are the acne breakouts, of course, because of those just dramatic shifts in progesterone and estrogen levels, as well as our testosterone balance relative to those other hormones.
Went way down, still way down, unfortunately.
Yeah. So, and we know that, so when your testosterone goes down, we can struggle with things like weight gain, or it's hard to build muscle mass. We may have low libido, but testosterone is tied in also with increased oil production, which manifests as acne and cysts. So maybe if you're somebody who has lower testosterone that plummets, that you don't have as many acne breakouts, but then you're suffering those other side effects, that your metabolism is not optimal. You might be holding on to a little bit more weight. You're not getting the results you want in the gym. So that's one big thing. The second is dryness and sensitivity of the skin, and that's primarily due to the decreased estrogen levels, and that's going to really impact that skin barrier that we talked about. So when that skin barrier is weakened and compromised, our skin is going to lose water more easily, so it's harder for it to stay hydrated. Our skin might feel dry, tight, it might get itchy and sensitive. So that's a big thing. You mentioned melasma and the hyperpigmentation, another very common finding both during pregnancy and in the postpartum period. And that has to do with the interaction between those hormones of pregnancy and the postpartum changes and how our sun's responding to ultraviolet light. And some of us may be more prone to that than others. And then, of course, stretch marks that happen as a result of all the changes, not just because of the baby growing within us, but because of all of these hormone changes throughout our body. It makes our skin more susceptible to that stretching and that strain, which is essentially when our collagen is not quite strong enough. So think of it like a cotton t-shirt that's being pulled apart, and it gets to the point where it's so thin, it almost, not that it's going to rip, but it just gets thin, and it's never back to that nice, tight, supple weave that it once was. So that's our stretch marks. I think all of us will say it is well worth it to have a couple stretch marks if that's the price we pay for those sweet babies. But when we can implement those lifestyle modifications that optimize our health, otherwise it acts as a buffer as we go through that transition and kind of that storm of all these hormone changes that are occurring in the during the pregnancy and postpartum period.
Yes, yes. No, I call them like my tiger stripes, but it's hard because, everybody, there's a lot of aesthetics out there. And so when you see the stretch marks on your stomach and your legs, you feel a little self-conscious. And it's one of those things where it's like empowerment, own it. But then when you see other people that don't have those marks, it's hard to not feel a little self-conscious.
Yeah.
And is there anything besides like surgery or I guess maybe laser, is there anything that helps reduce the appearance of those stretch marks?
Yeah, on a modest level, retinoids will help. So using the same topical retinoids that I spoke about earlier that we often use on our face to help maintain collagen, because stretch marks, again, are just that breakdown of collagen and elastic fiber. So when we can apply a topical cream that will help build that collagen, it's going to help. It's going to be a very modest improvement. We can get significant improvement with lasers, both vascular lasers that target the redness and inflammation that occurs in stretch marks in the more short-term kind of acute phase, and then what we call fractional resurfacing lasers, which essentially penetrate deeper into the skin and help stimulate collagen more significantly. Unfortunately, we don't have any procedure that's going to get rid of stretch marks completely, or any laser or chemical peel or other in-office procedure. Microneedling is another option that can be used. But generally, the microneedling that's done in a physician's office or a med spa, where it can go a little bit deeper. As you mentioned, surgery is more curative if you get a tummy tuck or something along those lines, because it's going to remove that loosened, lax skin, but you are also trading those stretch marks for the significant scar that comes with a tummy tuck. But sometimes that is a good option, especially for those women who never quite bounce back and they always have that little bit of a loose pouch of skin. I wish that there was a laser or a device that could significantly fix that, but I'm here to tell your listeners, don't waste your money. Definitely get opinions from multiple doctors, but ideally somebody in the plastic surgery space to discuss options.
Amazing. And the creams. So don't waste our time on all those creams that we see, the miracles where it's like, this will help reduce stretch marks significantly. Look at the testimonials. Again, Instagram gets me every time. And I'm like, no, that can't work.
It's a lot of marketing. When you go back to the clinical evidence and the studies that were done and you look at side by side, you will still find that the topical retinoids are way up here. And for your listeners, I'm holding my hand way up. So it's way at the top of the list. Whereas all the other, whether it's a growth factor, a peptide, an exosome, a hydroxy acid, they sit so much lower. Not that those aren't good for your skin, but they are not a magic fix. And any brand or ad that you see that is showing you a dramatic before and after from a cream that someone put on and all of their eye bags went away or their stretch marks went away, there's probably some lighting. They shouldn't be doctoring photos. That does happen sometimes, but there's usually like a change in lighting or the angle that's kind of optimizing that after photo. So just, Approach with caution, buyer beware. I'm here to tell you, if there were a magic solution like that, it would be presented at our dermatology conferences, and it has not. And it has not been published in our dermatology journals. And we do a ton of research in the aesthetic space and understanding these ingredients and how they work on the skin. People don't give sunscreen and retinoids the credit that it deserves because they've been around forever. So they're not as new and exciting as some of these other ingredients that have come out, but they are still win the race in terms of being the most effective.
That's so good to know. Just stick with the basics. Don't fall for all the ads and hype online.
You'll save yourself so much money.
Yes, guilty.
Save your money to go see your dermatologist and get an in-office procedure. Save your money for the laser or the microneedling in office or the chemical peel. I promise you'll be so much happier with the result, and you'll probably spend less in the long run.
Yes, no, that is the best advice. Thank you so much, Dr. Casey. Where can our listeners connect with you, learn more about your work?
Yeah, so you can find us on social media. Our handle is Bright Girl Beauty. That's all one word, BRIGHTGIRL Beauty. So just like it sounds, we're on Instagram, Facebook, TikTok, and you can find us on our website at brightgirl, BRIGHTGIRL.com.
Amazing. Yeah, your skin is beautiful.
Thank you. That's all I do. Retinol, sunscreen. I have not done any of the big laser procedures or chemical peels myself. So I really keep it simple, and I do that intentionally so I can kind of be I don't want to say not an advertisement or a poster child, but so I can tell my patients, look, with the right skincare regimen, you can keep really healthy skin lifelong. And I'm significantly older than you. But I think with those small things, I also do Botox too. I started doing Botox in probably my mid-20s. But with those few things, it's really helped avoid anything more aggressive. And but I am very consistent, very religious about getting my skincare on board every day.
No, I love that. I wanted to get your thoughts on something that I use daily. And as a dermatologist, what are your thoughts on beef tallow?
Oh, I think beef tallow, again, has gotten a lot of hype, but it's still, when you look at the chemical molecular structure, it makes sense that it would integrate into our skin, like help protect our skin. It's a natural product. It's one of those ingredients that's been used for thousands of years. We find so many of those in skincare, right? Like clay in our face masks, aloe, chamomile, marshmallow root. I mean, you find these ingredients that have been used for thousands of years for good reasons. And you think about people like our ancestors who are walking this earth, they killed the cow and they used that beef tallow to moisturize their skin. So I think that it's effective, but I also think it's like one of those ingredients, just like snail mucin a few years ago, or like bee venom. It's like kind of like taboo and exciting to talk about. So it's gotten a lot of press and attention because of that. But is it better than like a ceramide containing cream? No.
Yeah. Yeah. Because I've been using that for the past like 2 or 3 years. It's like that's part of my skincare routine is I get out of the shower and I put beef tallow on. And I was like, wait, I wonder if it's even good. It just feels nice and soft on my face. So
yeah,
like,
well, and it is a great option if you're an individual who prefers more natural options and doesn't want as many synthetic ingredients in your skincare regimen. The beef tallow is a great option. So it kind of comes down to personal values too. Obviously, somebody who's vegetarian isn't going to want to use beef tallow. Somebody who's not vegetarian and maybe doesn't want the chemicals that are in a lot of our other popular creams and lotions, that beef tallow is a great option because it's a very pure formulation, not many other ingredients added with that.
No, that's so good to know. Because like I said, my testosterone when postpartum always dips so much. And so my skin is always so dry. So it's like the one thing that I feel like I feel moist, especially we have hard water here in San Diego.
Mm-hmm.
Also makes my skin so dry. So yeah, I was just curious. I'm like, is it one of those things where I fell for the ad?
Not all ads are bad. But they definitely, I don't know. And I don't know if you have this experience, more often than not, I'm like pretty disappointed when I get that product in the mail. Like it looked so good on social media, and then I get it, I'm like, meh. Yeah,
Yeah,
it's okay. Like those leggings are not nearly the quality that they looked like in the ad.
thank you so much for breaking down all the science for us and keeping it simple because it was very helpful for me. I'm going to go throw away those microneedles that that I'm trying to do and stick to giving that to the professionals.
You have gorgeous skin, Shannon, so it's all about preservation and prevention of damage. So some simple habits will help you achieve that.
Thank you so much for your time, and we will chat soon.
Yeah, that sounds great, Shannon. We'll reach out anytime. I loved chatting with you. I love aligning with other empowered, smart thought leaders like yourself. So thank you for all that you're doing, and thank you for the opportunity.
Amazing. Thank you. Thank you. Have a wonderful day.
Thank you. You too. Bye.